to start by palpating the deltoid muscle here. So the first thing we're going to do is line out the origins of deltoid. So I'm going to have my partner just hold his shirt. Excellent. And we're going to start by palpating the lateral 1/3 of the clavicle, and more specifically kind of that anterior and inferior part of it. So as I'm palpating along the clavicle, especially as it's getting into that concave aspect of it, I'm going to ask my partner just to hold his arm into slight flexion. Good. And I can start to catch that edge of the front part here of anterior fibers of deltoid, and he's going to relax back down. So right here to here is that anterior and lateral third of the clavicle. As we get a little bit further out, we're going to pass over the acromioclavicular joint, and then at that point the deltoid is going to start originating on the acromion process. So I'll follow that lateral and then posterior, and then as it goes back behind this angle of the acromion, so from here to here and there, that's all the attachment on the acromion process, and that's the origin of our lateral fibers of deltoid. So I'm going to ask my buddies to hold his arm into abduction, and we can see that lateral head. Let's bring his arm back down. Okay, and just start to raise it again. Perfect, and back down. And the last part of the origin is on the posterior aspect, for the posterior kind of head or fibers of deltoid, and that's along the spine of the scapula here. So again, that acromial angle, I can easily follow the spine all the way back towards its origin at the root of it. And I'm going to ask my partner to do a little bit of external rotation and a little extension. And you'll notice a lot of rotator cuff muscles starting to stick up. So we're going to de-rotate him a little bit and ask him just to hold his arm in the air. Good. And now I can kind of sink in and start to pull up that posterior deltoid fibers. So again, origin along that spine of the scapula here as the fibers start to work their way down. So we'll continue with that posterior head. As I'm palpating, it's going to round out to the lateral aspect of the humerus, and we'll follow the same thing with the medial head. So I'm going to mainly grab this muscle belly. You can see as I'm kind of squeezing and lifting it up, a lot of its fibers start to taper to a point, and then as they come together, they're going to insert here on the humerus. So it's approximately halfway down the lateral aspect of the humerus on what is known as the deltoid tuberosity. I'm going to sink in, kind of cross fiber back and forth. I feel a little tendinous bit here. I'm going to ask my partner to do a little bit of abduction, and that tendinous part tightens right up. So again, that's the insertion. So the anterior fibers to the posterior fibers. So this is the entire deltoid kind of being picked up as it inserts here on the deltoid tuberosity. So let's talk about some of the functions of the deltoid. We've already used a few of them, but we're just going to connect some of the dots. So the anterior fibers specifically are going to be doing some flexion. They're going to be doing medial rotation and what is typically called horizontal adduction. So as one unit, it would bring the arm kind of up and across, doing all three of those things together. The middle fibers primarily only have one big action, and that is abduction of the arm at the glenohumeral joint. And our posterior fibers, they're going to be doing, again, three, kind of opposite of the anterior in the fact that they're going to extend the arm, externally rotate the arm, and do horizontal abduction, horizontal abduction, like so. All right, we're about to palpate supraspinatus, which is one of the rotator cuff muscles. So I have my individual in prone, and I'm identifying currently right now the spine of the scapula. So supraspinatus is originating from the supraspinous fossa of the scapula. So once I've identified the spine of the scapula, I want his trapezius to be in more of a passive state, which is why we have him in prone. I'm going to roll my fingertips forward, kind of pushing traps out of the way and sinking down into the supraspinous fossa. I'm going to ask him to do just a little bit of abduction into my hand. Good, and relax. And not a lot, but just enough to start to engage the muscle with its primary action. So again, we're not squeezing for this muscle. We're definitely going to have to sink down through trapezius. Now remember, traps is doing some upward rotation and elevation of our scapula, but supraspinatus is going to be acting on the glenohumeral joint, which is why we're asking him to do abduction and minimally to try to engage supra versus trapezius. Once I've identified the origin and the majority of its belly, I'm going to follow that lateral until I start feeling the acromion. Supraspinatus is going underneath the acromion process, which is from there to there, and then it comes out on the opposite side here, laterally, and it's going to insert fairly soon, almost right away, on what's known as the superior facet of the greater tubercle of the humerus. So you can basically almost draw a straight line following the supraspinous fossa, acromion, drop off. And if you sink in, it's not always comfortable, but you will come across some very ropey strands of supraspinatus tendon. The other way to get supraspinatus tendon to pop out is if, again, they're able to, putting the hand in the small of the back will draw the head down, which will make that supraspinatus tendon stick out even more, right in this area here. He's going to do just a gentle bit of abduction. Good. You're going to see a lot of deltoid firing, but deep to that's going to be the supraspinatus tendon. So supraspinatus is going to be doing abduction of our arm at the glenohumeral joint as it brings it away from the side, and we'll show that in the upcoming manual muscle test. And lastly, it is innervated by the suprascapular nerve. The next muscle that we're going to be showing you a video for here is going to be infraspinatus. So the first thing I'm going to do is border infraspinatus's origins. So the first thing that I'm going to find is the inferior angle, and I'm just using the web space of my hand and kind of pinching on both sides. So this is the medial border, and that is the lateral border of the scapula. So that it marks two of the landmarks, and the last one that kind of defines the infraspinous fossa is going to be the spine of the scapula. So as I've landmarked the spine of the scapula right here, everything inferior to that, medial border and lateral border, so inside that triangular space, is known as the infraspinous fossa of the scapula, which is the origin of infraspinatus. The muscle is going to run obliquely and some fibers superiorly here, and then some of them more just transverse like so, as they all come to more of a point and insert on the humerus. So one of the things I'm going to ask my person to do is we're going to take his arm, just hang it off the edge of the table. Let's orient ourselves a little bit because the scapula has moved a little bit here. Spine of the scapula, medial border, lateral border. And I'm going to ask him to do the primary action of this muscle, which is lateral rotation. So he's going to lift his arm up like so. Good. I'm going to go back, palpate in the middle of that fossa, ask him to do that again. Excellent. And you can easily start feeling the infraspinatus muscle fibers. Good. I'm going to follow laterally along the spine until I find that angle right here. So this is the angle of the acromion. And I'm going to drop just inferior to it and strum superior inferior. And this is where you're going to start to feel infraspinatus's musculotendinous junction. So it often gets very ropey and possibly a little bit tender in this location here. I'm going to bring his arm back up onto the table, this next point, as we sink in, and then once we get past kind of that acromial angle, we're getting onto the humerus. So infraspinatus is inserting here, which is on the middle facet of the greater tubercle of the humerus. I'm going to ask him again just to do a little bit of that external rotation. Good, and back down. Now you can feel it tightening up. It will be underneath the deltoid muscle, so you will have to sink through a little bit of extra tissue to get to that insertion point. This video is for the palpation of Subscapularis. So I have our body in supine today. And the first thing I'm going to do is kind of get into his axilla, as we're going to be looking for the subscapular fossa. So what we're going to be doing is kind of sinking into the axilla area. I often say try to find the deepest part where you see the most shadow. Be very careful about going into this location because it can often be very ticklish or painful. So what I'm going to do is I'm going to first push in until I start to feel some ribs, and then I'm going to start to go down. Now, this is going to make it a little bit harder for the camera to see, but I need to soften up that tissue. So I'm going to be medially rotating his arm and putting his hand onto his abdomen. Secondarily, what I'm going to do is I'm going to reach underneath. You won't be able to see this, but just kind of listen to my words for this part. And I'm going to get my body back to relax their arm down. I'm going to try to draw the scapula out towards me a little bit. And then with my hand inside his armpit or the axilla, I'm going to slowly sink in further. Now, a good way to sink in is to use the patient or a client's breath. So I'm going to ask him to take a nice deep breath in. And on his exhale, I'm going to sink a little bit further inside the axilla. And again, I might do this 2 or 3 cycles. So deep breath in for me and exhale. Good. If you find that your client is very ticklish, please try to use broad pressure. Don't make it painful, but again, using finger pokes is going to create a tickle reaction. I feel like I'm far enough inside the subscapular fossa for me to feel the majority of this origin. So what I'm now going to ask my person to do is to push his palm down. Good. And as soon as he pushes his palm into his abdomen, my fingers get lifted up and out a little bit. Again, you might be able to see it on the camera. Let's try that again. Up and out, good, and then back in. So each time he activates subscapularis by doing medial rotation, my fingers are kind of lifted up in that subscapular fossa. I'm going to slide my hand out. Now, do this very gently, but as I'm going to start to externally rotate him a little bit, you can see that I'm quite a ways into his axilla as I kind of move his arm around a little bit here. So the subscapular fossa, you're not actually going to be able to contact it, but you are contacting subscapularis with inside it. And again, it's responsible for doing this medial rotation of the arm at the glenohumeral joint. Since this is the origin, I'm going to be turning my hands and slowly making my way up towards the lesser tubercle of the humerus. So with his arm currently sitting in the neutral point, I can identify right here his long head tendon of his biceps brachii. And I'm going to roll slightly medial at that most proximal end, and this would be approximately where the lesser tubercle is. That's not that far of a difference. So with my hand currently in his axilla, I'm just going to slowly change my direction from pushing this way to trying to push up to where I believe that insertion was. So again, I'm going to change my pressure and slowly alter and work my way up towards that lesser. Now, finally, I'm going to bring his arm back into medial rotation, which will bring that lesser tubercle towards my fingertips. Pretty much on it right now with my index and my middle finger. And again, I'm going to get him to push down into my forearm now. Go ahead, excellent, and relax. And one more time. And I can feel the tendinous part of subscapularis pushing into my fingertips, deep to pectoralis major here. So we've palpated the origin along the belly and up towards the insertion on that lesser tubercle of the humerus. Now, as I bring my weight off my hand, I'm going to slowly sink out from being inside the subscapular fossa. As the last kind of comments on it, again, we're doing medial rotation of the arm at the glenohumeral joint, and this muscle is going to be innervated by the upper and lower subscapular nerves. The muscle that we're going to palpate in this video is known as Teres Minor. So the first thing I'm going to do is try to outline the borders and edges of our scapula here. So I'm going to take his arm and I'm just going to start to put it in the small of his back. And what I'm going to get him to try to completely relax. Excellent. So we can see the inferior angle here, and we're going to be palpating up along the lateral border of the scapula, which I've outlined with one hand at the bottom and one hand at the top. So this lateral border is often split into a couple different variances depending on kind of your reference source. But for Teres Minor, it's often referenced as the upper 1/3, but could also be half of that lateral border. So the superior lateral border of the scapula in this region. I'm going to bring his arm back, and I'm actually going to hang it off the edge of the table here. So I've identified what I believe is the origin for Teres Minor, and Teres Minor is basically a smaller version almost of Infraspinatus. They're both going to be doing a lot of external rotation. Now, teres meaning round, there's often a really ropey tubular muscle, which I can find right here, and I'm easily able to cross fiber it, but let's activate it just to confirm. I'm going to ask him to do a little external rotation, and as soon as he does that, that band of tissue got extremely tight underneath my fingers here. Excellent. So the origin, this muscle is really quite small, so as we go from that ropiness, and it's going to almost insert right away, so only a couple inches long, and its insertion point is here on the humerus, and again this is just below where infraspinatus inserted, so this is known as the inferior facet of the greater tubercle of the humerus. I'm going to put him back into anatomical, more based position here with his palm facing forward. As I find inferior aspect of that angle of the acromion, so this would be infraspinatus's insertion, and just below that right there is going to be Teres Minor. So again, the ropiness of Teres Minor and the insertion on the inferior facet of the greater tubercle of the humerus. Teres Minor is responsible for doing external rotation, just like Infraspinatus, but some texts also reference that it has some ability to do some horizontal extension or even extension, and again adduction. So there's a variance in some of the references on what the actions are, but the main one that we're going to be focusing on is external rotation of the arm at the glenohumeral joint. The last piece of information about our Teres Minor muscle right in here is that it is innervated by the same nerve that goes into our deltoid, and that is the axillary nerve. This video is for the palpation of Teres Major. So the first thing I'm going to do is again try to outline the lateral border of our scapula. So if the person is able to, I can take their hand and put it into the small of the back. I'm going to have to try to completely relax their muscles of the shoulder. Excellent. So you can easily see our inferior angle here, and I'm going to palpate all along that lateral border. So from top to bottom. Again, the lateral border is often split between Teres Minor, which is more superior on it, versus Teres Major, which is more inferior. So depending on your reference source, a lot of people will say the inferior 2/3 of the lateral border of the scapula is the origin of Teres Major. So right along here. Now I'm going to take my partner's hand, and I'm going to actually hang it off the table like so, and again reorient myself. So here's that inferior angle, and I'm going to go up along that lateral border, and then with my other hand I'm going to reach down and give him resistance to his wrist and forearm, as I'm going to ask him to do this medial rotation. So whenever you're ready, good. And a lot of people, you can actually quite easily see it, Teres Major is sticking up, so go ahead right there. And so the Teres Major muscle is heading towards our axilla, but at this point is actually starting to get kind of blended and meets up with latissimus dorsi. So you have to be careful, especially as we're heading in towards that axilla, that you're not grabbing all of the muscle tissue that's sitting in this part of the scapula and kind of axilla, that you're mainly trying to isolate just the Teres Major component of it. So as we start heading in towards the axilla, the muscle is going to go through the axilla and heading to what is known as the bicipital groove, and Teres Major inserts into the medial lip of the bicipital groove. So what I'm going to do is actually I'm going to fully medially rotate his arm. I'm going to rest his arm on the table here. I'm going to ask him just to lift his hand up towards the ceiling a little bit for me. Good. And I'm going to follow that into the axilla. I'm going to ask him to do that again. Good. And at this point right in here, you actually can start to feel the neurovascular bundle for the brachial plexus. And the pulse location is showing you that you're getting really, really close to that medial aspect of the arm. So take caution as you're pushing in this area because it might become very uncomfortable or even painful. Now, you can feel the insertion of Teres Major from the prone position, but it's actually easier for us to visually see it from the supine position. We have our person in supine. I'm going to be looking for Teres muscle, so I'm going to bring his arm all the way up above his head, and right in this area you can actually feel the inferior angle of the scapula sticking up. So as I go along it here, I'm actually on that lateral border, that inferior lateral border of the scapula, which is where Teres Major originates. I'm going to have my person try to do some medial rotation, bring his arm down towards the table. Good, good. And as he does that, I can easily start to feel a nice roll of muscle, teres, meaning round or tubular. And I'm going to follow that right up towards the axilla. You're going to start to lose it at this point as it starts to go underneath Biceps Brachii, but it's heading towards the bicipital groove, specifically the medial lip. So with my other finger here, I'm going to find the long head tendon of his Biceps Brachii, which is here. And I'm going to ask my person to slowly medially rotate their arm down towards the table. And as he does so, that biceps tendon gets closer and closer towards my finger. So you can kind of see how Teres is going to bring that bicipital groove closer towards the posterior scapula. So the insertion is actually right up underneath pectoralis major here, and that is on the medial lip of the bicipital groove. I'm going to ask him to do medial rotation against some resistance. Excellent. And right in here, I can feel the tightening up of Teres Major. It's going to be harder to distinguish what is latissimus dorsi, which is actually sitting a little more anterior to Teres, as the two of them basically blend together to insert in a very similar location on that medial lip of the bicipital groove. This video is going to be for the palpation of Biceps Brachii. So we have our individual in a supine position. We're going to talk about both heads, biceps being two heads, and they have separate origins. So we'll be finding the coracoid process, which is currently where my fingers are, and then the other one is a non-palpable structure that we'll kind of discuss. So with Biceps Brachii, for finding the coracoid process, again, you can use the palpation videos from previous for finding bony landmarks, but really I'm going to be inferior to the lateral portion of the clavicle here. I'm going to drop down, and if I use some medial and lateral rotation, I should not be moving when I'm on that coracoid process. I'm going to get him to do a little bit of a bicep action. So in a supinated position of his forearm, I'm going to ask him to flex his elbow. Good. And you can feel a little bit of tightening up inferior to that. Now we're also going to be palpating this underneath his pectoralis major. So what we're going to do is I'm going to shorten up his biceps to start. So in this region here, biceps, I'm going to soften up his pec or slacken it by passively bringing his elbow up. I'm going to go underneath pectoralis major until I get up. And right there, might be hard to see, but I'm on his coracoid process from underneath pec. I'm now going to ask him to do that bicep elbow flexion for me. Go ahead, good. And my finger basically right in here there's a tightening up. So I'm on the short head of Biceps Brachii right now, underneath his pec major, making contact with that coracoid process. The long head, which is sitting the tendinous part of it inside the bicipital groove. So right in here, I can easily cross fiber strum that. The tendon's going up, it's going to go underneath the acromion, and then it'll become unpalpable as it's making its way towards the supraglenoid tubercle of the scapula. So in reality, we're only going to be able to start palpating it right here as it's going between the greater and lesser tubercles of the humerus. And then the tendon becomes very obvious as it makes its way down into the arm. It meets up with the short head, and a lot of times you can actually kind of separate the two heads a little bit, the proximal end. So I'm going to get my person to resist. Good. So you can easily see kind of biceps here. But if you kind of go to the more proximal part and gently sink in, I'm getting him to relax a little bit. Good. You can actually start to separate the long and short heads of biceps here and here. They're going to blend together as they go down. So I'm going to again get them to gently fire that for me. Good. And as I work my way down, it's narrowing to a point which that biceps tendon is quite easy to find and strum. You can actually even stick your finger up underneath a biceps tendon quite easily on that distal end. As it crosses the elbow joint, the biceps has two insertion points. So the first one's more superficial and a little bit confusing in its direction, but it's actually inserting into what's called the bicipital aponeurosis, which feels like it's heading towards the ulna. So again, I'm going to get you to resist for me just a little bit. Good, and right here, it's quite superficial, and it starts to fan out as it's more of a fascial connection. The second landmark for the insertion is where the more of the tendon's inserting. So I'm cross-fibering his tendon right now. I'm going to sink in to his forearm. So I have him in a flexed elbow position passively, which shortens up the muscle tissue, making it easier for me to sink down. And I'm heading towards what is known as the radial tuberosity. It's also called the bicipital tuberosity, obviously because biceps is inserting into it. I'm using a little bit of supination and pronation for me to feel the spinning action of radius underneath my fingers, so I know that I'm on it. And lastly, I'm going to get him to gently do that biceps action. Good. Right there, my finger's going up and down. Let's do it one more time. Up and then relax. It goes back down. So I'm as close as I'm going to get to that radial tuberosity of the radius. So that'll be the insertion. Again, one's more superficial and then one's deep inside the forearm. The biceps brachii is going to be responsible for several actions at multiple joints. So we'll talk about the first one up at the shoulder here. Because of both of the heads are starting on the scapula, it's going to be responsible for doing flexion. And some texts will also talk about doing more of a horizontal flexion or adduction component. As the bicep goes down, it crosses the elbow joint. So it's responsible for doing flexion at our elbow. And its insertion is on the radius. So as we start in a pronated position, it's actually going to pull the radius upwards. So we call that supination. So it's doing supination of the radial ulnar joints, flexion at the elbow joint, and flexion at the glenohumeral joint. And this muscle is innervated by the musculocutaneous nerve. This video is going to be for the palpation of Coracobrachialis. So Coracobrachialis is going to be originating off the coracoid process of the scapula, which I'm currently circling right now over top of pectoralis major. But we're going to be trying to find this origin underneath pectoralis major, similar to biceps brachii. I'm going to be taking his arm, and we're actually going to be starting more the insertion of this muscle and then work our way towards the origin because the insertion is much easier. So I've put him in about 90 degrees of abduction and a full external rotation, which you can actually easily see his medial epiconda of the humerus right here, which means that I'm looking at the medial shaft of his humerus. Now, Coracobrachialis is going to be inserting into the middle medial shaft. So again, you can eyeball it to start if you wanted to, and thinking about approximately halfway. And I'm going to be trying to feel in this region for the muscle when it starts to activate. Now, the other reason why I have full elbow flexion is because I want to take out biceps. Bicep does a lot of action at the elbow joint, but coraco does not. It's only going to be acting at the glenohumeral joint. So by bringing him into a maxed passive flexion at the elbow, I'm going to get more activation of coraco than I am of biceps. What he's going to try to do is bring his elbow or olecranon across his body, like so, doing horizontal abduction. I'm going to let him win a little bit, so we're going to start up in this position. I'm going to add some resistance down, so I'm pushing down while he lifts up. And it's quite easy to find Coracobrachialis at this point. So again, his biceps is a lot softer, but his Coracobrachialis is quite taut. So this is how you would identify where the muscle belly is, and I'm going to follow that out, and I'm going to start to lose it when we get closer to that middle shaft. As he relaxes, and we take a look at that again, I'm right in the middle of that medial surface. So this is our insertion on the humerus. Another way to do that is that oftentimes we say this is about the size of a whiteboard marker or a highlighter pen. So it's a little bit of a smaller muscle that we're looking for, but it's easily graspable. As it works its way up towards that axilla, it's going to go underneath pectoralis major. So I'm going to soften up pectoralis major by bringing him further into that horizontal adduction. Now it's really, really important that they're not doing that for you and that you're doing it as passive as possible so that you're not getting pec major kind of resisting your palpation. Biceps brachii short head is just above my fingers. I'm just below that, and I'm going to sink underneath pectoralis major and work my way towards that coracoid process. So I can feel that right there, and again, I'm trying to get him to bring his elbow across his body a little bit for me. Good. And as soon as he does that, I can feel Coracobrachialis off of the coracoid process for our origin. If Coracobrachialis was in anatomical, the actions that it's going to be performing is going to be flexion of the glenohumeral joint as well as adduction. So the combination would actually bring the person's arm in front of their forehead. So a good way to think about that is asking the person to bring their elbow in between their eyes. Okay, so a combination of flexion and adduction is its action, and Coracobrachialis is innervated by the musculocutaneous nerve. Is going to be for the palpation of Brachialis. So for Brachialis is originating on the distal anterior surface of the humerus, and that basically means that we need to palpate underneath Biceps Brachii. So to get at that origin, there's two ways. We're going to both push it and pull it out of the way, depending on how you look at it with your hands. But I need to soften up his biceps first. I'm going to get him to activate Biceps Brachii first, just so you guys can have a visual of that. So in a supinated position, I get to see kind of the edge of his biceps right here. Now, as he relaxes that position, I still have that edge of muscle belly. I'm going to push it medially right off. So now my fingertips are over top of the anterior surface of his humerus. I'm actually going to get him to turn his palm facing down. So we're actually putting the forearm in pronation, and I'm going to ask him to try to bring his elbow up through flexion. Go ahead. Great. So I'm pushed over biceps. I'm down on top of brachialis as he's going through elbow flexion, and I can easily feel a muscle pushing my fingertips up. I'm going to follow that down. Good. Now I'm going to do the exact same thing, but I'm going to be pushing biceps laterally this time. So I'm going to switch hands. Again, let's fire off biceps just to get a visual. Good. We're going to push it laterally this time, and I'm going to turn him over into pronation. So now I have biceps pushed over laterally. My palm is down on top of the distal anterior surface of his humerus, and he's going to do some pronation and flexion. Good. So it's not so much the action of pronation, it's just putting the forearm in pronation to weaken our biceps brachii. As I follow down brachialis, it's going to cross the elbow joint, and it's going to be inserting into the ulna. I'm going to turn him back into supinated for just a second. You can see the biceps tendon right here as I'm kind of cross fiber strumming it. I want to stay medial to that because we know this tendon is heading towards the radius, where brachialis is going to be heading towards the ulna. So right here at that flexor crease of the forearm, I'm going to cross over that anterior part of the elbow, and just start to sink in what is the coronoid process of the ulna, and then just distal to that is the ulnar tuberosity. I'm going to, again, passively flex his elbow up, making it a little bit easier for me to sink in. Put him in a pronated position and ask for him to flex his elbow for me. Go ahead. Great. And then relax. And so deep to my fingertips, again, is the coronoid process and the ulnar tuberosity of the ulna, which is the insertion for brachialis. Now, brachialis's only action is to do flexion of the elbow. And so in reality, it doesn't really matter which position the forearm is in. It's always going to be doing that flexion. But as we've mentioned already, to take biceps out, we usually have it tested in a pronated position. It does not do pronation, it just does flexion of the forearm at the elbow joint. And lastly, it is innervated again by the musculocutaneous nerve. So the muscle that we're going to palpate in this video is brachioradialis. We're going to start with our person with their forearm resting on the table, and we are going to be looking for one of the three muscles that's often referred as a part of the wad of three. So this muscle is technically the most kind of anterior of those three muscles, and it is responsible for performing flexion at the elbow joint. So having our individual in this position, to get this muscle to stick up, making it easier for us to palpate, I'm going to ask for her to do flexion at the elbow with her thumb in what we call a neutral plane. So halfway between supination and pronation. So we leave it here. It's really, really important though, as we add resistance, that we don't want to put any resistance to the wrist joint because of the actions of extensor carpi, radialis longus, and brevis, which do radial deviation. So for brachioradialis, we're going to put just a little bit of pressure on the distal end of the radius near its styloid process and ask our person to again do that flexion component. Please go ahead. Good. Back up at the proximal end of the arm here, brachioradialis starts to stick up, and so we can get a pinch of grasp on that muscle. We're going to follow it towards its origin as we work our way into the humerus area around here. So brachioradialis is originating on what we call the lateral supracondylar ridge. This finger that I'm tapping with right now is currently on the lateral epicondyle, and we can often put three fingers just above that lateral epicondyle, and these three fingers are representing the lateral supracondylar ridge. The top two fingers are on the superior or proximal portion of that. So proximal 2/3 of the lateral supracondylar ridge is the origin of brachioradialis. I'm going to get her to push up again. Great. And right there, I can feel that origin of the muscle. We're going to go back to feeling its muscle belly. I'm going to get you to push up again. Just sustain pressure for me. And we're going to follow this muscle down. Approximately about halfway, it starts turning more into a tendinous component. And you can cross fiber the tendon as we work our way down the forearm, where it inserts just at the base of that styloid process of the radius. So our insertion being around here. Because of brachioradius's insertion on the radius, this muscle also has a little bit of a component doing pronation, bringing the radius into neutral, as well as supination, again bringing that radius into neutral. And this muscle is innervated, just like all the other extensors, by the radial nerve. This video is going to be for the palpation of Triceps Brachii. So the first thing that we're going to do is have our person's arm hanging off the table, which is going to kind of give us access to the triceps muscle. Triceps meaning three heads, so we're going to talk about the origins of all three heads and kind of where their placements are, and then their insertion. So the first thing that we're going to do is look for our long head. So triceps has three heads, as I was just mentioning, and the first of them is going to be the long head. The long head is the only one that passes the glenohumeral joint, and its actual origin is on the most superior aspect of the lateral border of the scapula, which is up in here, and that is the infraglenoid tubercle. So I believe I've landmarked it. So what I'm actually going to do is get him to push out into my hand in extension. Great. And we can actually quite easily see that. Let's do that one more time and have you hold that position. So right here is that head as it goes up in between Teres Major and Minor. I'm going to get you to relax. And then right there I can feel the lateral border of the scapula, kind of just below the glenoid cavity on that scapula. So our long head travels down the medial aspect of the arm before it turns tendinous in and around here. So I'm going to get him to actually go through and hold that position for me. So right there, good. So you can actually quite easily see that transition from muscle belly here into tendon. So the belly is up in the medial aspect of that arm, and then it's tendinous before it goes down, inserting into our olecranon of the ulna. So first head that we're going to talk about. Head number 2 is going to be the lateral head. And the lateral head has an origin that's just above a different landmark. So I'm just going to discuss that first. On the posterior aspect of the humerus, there is a groove that runs kind of superior medial to inferior lateral, and that is for the radial nerve. So it's called the radial groove of the humerus. So above that is where the lateral head originates. The other thing that you can do to try to landmark it is try to find the edge of our posterior deltoid. So if he holds his arm up in the air for us, like so, there we go, I can find that posterior deltoid here. I'm going to lay my finger across that. We're going to bring his arm back down, and I'm going to ask for him to extend his arm out. Perfect. So right in this region is our lateral head of the triceps, and it actually wraps around, meeting up with Brachialis in the front here. So lateral head runs down the lateral aspect of the arm before it turns tendinous, kind of meeting up with that long head over here and going down to our olecranon. And then our last head of triceps is going to be the medial head. So if this was the spiral groove, otherwise known as the radial groove of the humerus, then everything kind of distal to that on that posterior surface, getting closer to our olecranon fossa, would be the origin of the medial head. So it is the largest surface area of the 3 head origins. A big portion of the medial head is actually covered by the long head. So in this case, I'm going to try to grab his long head and kind of pull it over. And then I'm going to ask him to extend his elbow out. Good. And you can actually easily see right in here. So below the long head, the medial head is definitely sticking out on the side. He's going to relax. But it also is on the lateral aspect below the lateral head. So I'm going to sink in underneath the lateral head over here. And again, without resistance, I'm just going to ask him to extend and lock his elbow for me. So my fingers are getting pushed out on both sides. So you can also squeeze kind of that distal tendon portion. And again, relax, and you'll see the width change. Go ahead one more time. So this is the medial head that's kind of pushing my fingers out on both sides. So underneath the long and a little bit of that lateral, the medial head blends with the other 2, and all 3 of them are incident here on the olecranon process of the ulna. All 3 heads of the triceps are innervated by kind of the radial nerve, which travels underneath it. So it's innervating all 3 components. The medial and lateral head, and as well as the long head, all do extension at the elbow, like so, but only the long head acts on the glenohumeral joint, and it does extension or horizontal extension, depending on how you kind of look at that. In this video, we're going to be palpating Extensor Carpi Radialis Longus. Extensor Carpi Radialis Longus is the second of 3 muscles in the wad of 3, and its origin, similar to Brachioradialis, is on what we call the lateral supracondylar ridge. So I've identified her lateral epicondyle of her humerus here, and just above that, on the distal 1/3, is the origin of Extensor Carpi Radialis Longus. By placing my finger here, I'm then going to ask my partner to do some radial deviation and extension. Good, and if you could do that a couple times on your own, and we can see my finger, and again one more time, going up and then down as she completes that action. Up and down. This muscle is sitting right next to brachioradialis. So one of the things that we often do is try to identify brachioradialis, like so, and then place palpating fingers just posterior, if you're talking anatomically, to it. So I'm now resting on what I believe is the muscle belly, Extensor Carpi Radialis Longus. I'm again going to get her to do extension radial deviation. Great. And I can easily feel that going up and down underneath my fingertips. And we will follow that until it turns tendinous, which is usually around that halfway point in the forearm. This muscle is going to be inserting into the base of our second metacarpal. So at this point, I'm going to find the metacarpal. This portion is its head, following back along the shaft, and as it widens right here, that indicates the base, the more proximal part of that second metacarpal. So between these two locations, I'm going to ask her just to do a little bit of extension and radial deviation. Good, and hold that. I can easily cross fiber that tendon as I'm following it towards my distal finger, denoting its insertion right here. Especially across the back of the wrist, you can easily feel the tendon for Extensor Carpi Radialis Longus. It's going to be doing, again, a couple actions at our wrist, as we've discussed, in extension and radial deviation. And because of its attachment higher up on the humerus, on that supracondylar ridge, it also acts doing flexion at the elbow joint. Just like all the other extensors in this group, it's innervated by the radial nerve. Following our palpation of Extensor Carpi Radialis Longus, we're moving on to palpating Extensor Carpi Radialis Brevis. Extensor Carpi Radialis Brevis is going to be originating on the lateral epicondyle of the humerus via what we call the common extensor tendon. Because of its close proximity to longus and its similar function, I'm actually going to be using Extensor Digitorum to help differentiate it. So the first thing I'm going to ask my partner to do is rapidly tap her fingertips on the table, and you should be easily able to see Extensor Digitorum. Once I've identified Extensor Digitorum, I'm going to move slightly over so I do not feel it anymore. Let's try that one more time. Rapidly tap. Good. So I'm no longer on top of its belly. And now I'm going to again ask for her to do extension and radial deviation. Good. So again, my fingers are going up and down. Where I was previously over here is brachioradialis, leaving a spot in between my thumb and my fingers where Extensor Carpi Radialis Longus would be. So from Extensor Digitorum and Extensor Carpi Radialis Brevis, right in this region here, on the lateral epicondyle, I'm going to get you to pulse that radial deviation extension. Good. And I'm going to follow it down the forearm. Good, until I start to lose that muscle belly again around the mid-range. Now, Brevis is going to be inserting similar to longus, but instead of on the second, it's inserting on the third metacarpal at its base. So I'm going to try to gently sink my fingers in between her metacarpals in this region and work my way back until I can no longer feel an interosseous space. So in this space, it's now again more muscle, and now it's bone. So that's denoting I'm over top of the bases, base number 2, base number 3. So for Brevis, it's inserting on that dorsal surface, base of the third metacarpal in this region. I can again have you do some extension, just kind of hold that up for me. I'm going to cross fiber that tendon, slowly working my way down the rest of the forearm, following that top band of a tendon, crossing the wrist joint, and then inserting again here on the base of that third metacarpal. This video is for the palpation of Extensor Digitorum. So we're going to be positioning our person in the forearm, resting in her hand out on the table. Extensor digitorum is one of the muscles originating off the common extensor tendon and therefore off the lateral epicondyle of the humerus, right in here. I'm going to get you to rapidly tap your fingers for me. So just off that Moni landmark, I can feel the beginning of that tendinous portion. And I'm going to take my fingers and do a pincher grasp outlining both sides of extensor digitorum. It's quite wide in the forearm. Good. And as we work our way down, keep rapidly tapping those fingers for me. And I'm going to continue to follow the muscle group down until it makes its way to the forearm. Okay. So in and around the middle of the forearm here, I'm going to have you just rest your fingers out. I'm going to take my fingers and place them over top of kind of the insertion. So I'm going to have you push up into my hand and hold. And I'm going to continue following the tendinous group down past the wrist. Now these tendons are held in check by extensor retinaculum. So if she was to hold her hand way up in the air with those fingers out, those tendons are not going to stick up past this location since they're being almost strapped and held down. Once it makes it into the hand and the fingers, I'm going to get you to push up just with your index to start and hold that. So I'm going to strum one tendon at a time as it works its way past the metacarpophalangeal and into the phalanxes. And it's going to be inserting on both the middle and the distal phalanx of this finger via what's called the dorsal digital expansion. We're going to continue this palpation for each of the other fingers. So I'm going to have you lifting and holding this up. So I'll follow the tendon into the third finger all the way again to that middle and distal phalanx. We'll repeat it on the ring finger as we follow that tendon all the way out to the middle and distal. And finally, for the pinky finger, or the fifth digit, all the way to the middle and distal. So again, extensor digitorum is inserting into fingers 2 through 5, the middle and distal phalanx of all those fingers via the dorsal digital expansion. And as per all of our muscles on the extensor group, they are all innervated by the radial nerve. We're going to be palpating extensor digiti minimi in this video. So we're going to be starting very similar with digitorum's attachment on the lateral epicondyle of the humerus via the common extensor tendon. But in this case, I'm going to ask you to start by making a fist and then just rapidly tap your pinky finger. So the slip for extensor digitorum should be visible. As you can see me slowly going down along it, and you can see that muscle firing. Very similar to extensor digitorum in a lot of ways. However, its tendon is separate at the wrist. So as I work my way down, this one is going to be closer to the head of the ulna. So I'm just going to go onto the posterior aspect of the forearm, right next to the head of the ulna. And as she rapidly taps that, I can easily feel the tendon there. Now I'm going to add a little bit of resistance to the distal phalanx. And I'm going to follow that independent tendon where it actually blends with extensor digitorum. So they meet typically in and around the back of the hand here in the metacarpals. And those two tendons go together, inserting into the middle and distal phalanx of that fifth digit. Just like extensor digitorum, this one is also innervated by the radial nerve. This video we're going to be palpating extensor Carpi Ulnaris. So I'm just putting my hand underneath her elbow to lift it up to make it a little easier for us to see. First thing I'm going to be identifying is one of its two origins on that lateral epicondyle via the common extensor tendon. So if I could have you just do this ulnar kind of motion, good, and we can start to feel that origin here. Now the second origin is on the ulna, but what you're going to be looking for is after anconius. So anconius is originating and attaching in the same location, but attaches to this proximal ulna and olecranon. But the second origin for extensor Carpi Ulnaris is on the middle ulna past anconius's insertion. So right in this region here, we're along that bony shaft and we're kind of rolling onto the extensor side. So if you can again do that ulnar deviation for me, perfect. So you can actually do a bit of a pincher grasp of extensor Carpi Ulnaris, especially over top of that ulnar attachment here. And then it's going to turn more into a tendinous part. So you can hold your hand up like so. It'll put some resistance against it. Good. So I'm cross-fibering the tendon, cross-fibering the tendon. It's crossing the wrist right here, quite easy for us to feel. And its insertion is on the base of the 5th metacarpal. So I'm just kind of squeezing the bony structure, and right there is its base, and just proximal to that is the obvious tendon. So this is our final insertion point for our muscle here. And again, the actions are going to be in extension and ulnar deviation at the wrist joint. And because similarly Anconius does extension, there's often a lot of text that will say this one can aid a little bit in extension at the elbow joint as a minor action. This muscle is also innervated by the radial nerve. We're going to be palpating Abductor Pollicis Longus. So we're getting into the deep extensors of the forearm here. Abductor Pollicis Longus has a bit of an interesting kind of pathway for itself. So we're going to start by locating its origin. First thing we're going to do is try to identify where the head of the radius is, which is right in this region here. And the Abductor Pollicis Longus is originating on the ulna as well as the radius and deep on the interosseous membrane. And if we looked at kind of in a quarter section, it's in the middle and a little bit above that. So right in here. Now I'm going to take her thumb. What I'm going to ask her to do is try to spread her hand and her thumb apart as if she was going to hold on to an object, so that thumb moves away from that index finger. And I'm going to get you just to repeat that several times. Good. So we're going to follow down forearm in here. And then it's going to start to cross from posterior towards anterior. I'm going to give you a little bit of resistance. You can just push it in there. Great. So I can actually cross fiber the tendon. It's got a nice synovial sheath protecting it. So it's actually fairly thick and fairly obvious to find. So you can find it quite easily there. I'm going to turn our hand just over a little bit more to a palmar view. And it's crossing the wrist joint right here as it inserts onto the base of this first metacarpal of the thumb. So right in this area, you actually have a sheath that's holding both Abductor Pollicis Longus and Extensor Pollicis Brevis kind of wrapped up together. So it might get a little bit tricky as you're passing the wrist in this location. But again, its insertion is kind of right here on the base of that first metacarpal. Because of this pathway, the actions of Abductor Pollicis Longus are a little bit tricky. In its name, it's going to be obviously abducting the thumb, kind of bringing it away. It secondarily often helps with a little bit of extension of the thumb. So again, as the thumb is brought back, this being extension, this being more abduction, so almost a combination. And then to try and get this metacarpal back towards the forearm, it often ends up doing radial deviation of the wrist, like so. Questionably, as it's going to be doing more extension or flexion, so we're just going to leave that out for now. So we're going to be focusing more on abduction and radial deviation of the wrist joint. Okay. Again, as for all of our muscles in this posterior aspect of the forearm, it is innervated by the radial nerve. We're going to be palpating the muscle known as Anconius next. Now, Anconius is kind of a synergist with tricep. However, its main function is at the end range of elbow extension. So we often call that terminal extension. It's originating here on the lateral epicondyle of the humerus. So in this case, it's going to look kind of more like a triangle. So I'm going to show you the whole muscle first before we start activating it. And its fibers run straight down, in this case, towards her olecranon, and then start to fan out to fill in our whole triangle shape. So it inserts on the olecranon and that proximal posterior shaft of the ulna. So I'm outlining 3 points, trying to show my triangle shape, and I'm going to ask my person to lock their elbow and go all the way into extension. And what you often see is there's an indentation that shows up and quite easily a triangular shape right there. So I'm going to put my thumb right in the middle of that. I'm going to get a relax and then again push into terminal extension. Good. And we can easily feel the anconeus muscle, which is often, even in a slightly bent elbow, soft, but as soon as it goes into a locked terminal position, it becomes quite hard in this area. So that is the origin to insertion. Now again, anconeus, just like triceps, is also innervated by the radial nerve. We're going to be palpating extensor indicis. So extensor indicis is the lowest muscle on the posterior forearm or distal muscle. Its origin is going to be on the distal posterior ulna as well as the interosseous membrane. So one of the things I can use is identifying the head of the ulna here and then palpating just proximal to that and sinking in. I'm going to have you make a fist, but then just do extension of your second digit for me. Good. I'm just going to place my fingers over top of this muscle belly and you should easily be able to feel it going up and down. Now what you want to make sure is that you're not getting confused with Extensor Digitorum. So I'm going to leave my fingers here, but now I'm going to ask you to move all of them. So Extensor Digitorum's muscle belly will be found in the proximal forearm. And let's go back to just the index, but Extensor Indicis is going to be in the distal posterior. So you should notice a difference between those two. Now this tendon is going to be deep to Extensor Digitorum and the other muscles in this area. So the tendon goes underneath and it's fairly challenging to find. So we're not really going to be able to distinguish it in comparison to the ones that are crossing over it. But if we notice right here, she holds her finger up in the air, you can actually see a bit of a tendon pull change. So I'm going to get you to repeat that a couple times. So right in this area, this tendon's getting pulled over on an oblique angle in comparison to the digitorum tendons, which are going straight back, which is why we have this hand in a fist right now, is to lengthen all the extensor digitorum tendons and focus primarily just on indicis. I'm going to have her hold her finger up and hold in this position. So as we get into the hand, I'm going to cross fiber this tendon. It blends with extensor digitorum, and therefore it's going to be inserting, just like digitorum, onto the middle and distal phalanx of this second finger. So, and that is via what we call the dorsal digital expansion. So it is doing extension of the metacarpophalangeal joint, the proximal and then distal interphalangeal joints, plus it has some weak extension at our wrist joint. As per all of the muscles on this extensor surface, they are all innervated by the radial nerve. We're going to go into the palpation of extensor pollicis longus and brevis in this video. Now these two muscles are both originating on the posterior aspect of the forearm. We call it the deep layer in this area, and they're both inserting onto the thumb. So we're going to kind of combine these two in similarities and try to differentiate them at the same time. So as an action for extension, we're going to be lifting the thumb up. And on a lot of people, you'll actually start to see what we call the anatomical snuff box, as it's referred. So if I have my partner hold their thumb up in extension, there's often two tendons that start to stick up. One is right here, and the second one is right in here, and there's a little hollow that often shows up. I'm just going to show it on my own thumb for a second, just so you guys can get a sense of that. So right in this area here. So this is going to be our extensor pollicis longus tendon, and this will be our extensor pollicis brevis tendon. For palpation and finding the origins, we're going to use the tendons and work our way back into the forearm. So I'm going to start by finding the longest tendon. So I'm going to be resisting on the distal phalanx, asking her to push up into me. Its insertion is on the distal phalanx of the thumb, and it's named for longus. So I'm going to get you to push against in here. And I'm cross-fibering our tendon right now. It's going to head crossing the wrist joint in this area. I'm going to slowly turn her over so that her palm is going down. You can pulse that a few times and just push. Good. And as we cross into the forearm, it'll make it a little bit more challenging to feel. However, I can still kind of see my finger going up and down a little bit. And it's making its way over to the ulna. And this is going to originate approximately halfway down on the posterior surface of the ulna, and then deep to that in the interosseous membrane. So in this region here is our origin. And again, go through that action unresisted, and you can easily see my fingers going up and down in this region. So this would be the origin of Extensor Pollicis Longus. We'll follow it down one more time. I'm going to turn her hand, give her some resistance to make that tendon stick up, and follow it all the way to the distal phalanx. Extensor Pollicis Longus is going to be responsible for extension of the thumb at the interphalangeal joint, the metacarpal phalangeal joint, as well as doing some radial deviation at the wrist and often a little bit of extension combined with that. Now for Brevis, it's going to have very similar actions, except its insertion is on the proximal phalanx instead of the distal phalanx. So as I resist it, I want to make sure I'm pushing on that proximal phalanx and not on the distal. So I'm going to have you push up into me here. Good. So you can see that's changing the mechanic of the thumb action a little bit. The origin is going to be on the radius this time instead of the ulna. But I'm going to still follow that same method as getting her to resist and following our tendon. So from the base of the proximal phalanx, we will cross fiber the tendon. It's crossing the wrist joint right in here. Again, able to quite easily cross fiber the tendon because of its synovial sheath. And it's going to go deep to the other two thumb muscles, abductor and extensor pollicis longus, as it originates down here on the distal posterior surface of the radius and the interosseous membrane. So again, I'm going to have you pulse that a few times and we can see my fingers going up and down. So I'm going to put my fingers on both brevis and longus. So currently my fingers are on extensor pollicis brevis and a little bit higher and a little bit more on the ulna, and this is on extensor pollicis longus. So again, both of these muscles in the deep posterior layer and both innervated by the radial nerve. We're going to be palpating Pronator Teres. We have 4 superficial muscles coming off this medial epicondyle of the humerus by way of what's called the common flexor tendon. So this is the first of them, which typically is considered the most lateral of that group. Pronator teres has 2 heads. So one of the heads, called the humeral head, will be originating here off this medial epicondyle. I'm going to start by trying to palpate that. So I'm going to bring her into a neutral kind of thumb up position, and she's going to be turning her palm face down against a little bit of resistance. So go ahead. Excellent. So right away I can start to feel the roundness, the teres component or tubular of teres and Pronator teres here. And we're going to get her relax. So this is the first origin in belly. Now the second origin is actually quite a bit deeper. So what I'm going to do is first passively flex her elbow up, softening up the forearm muscles here and that biceps brachialis area. I'm going to take 1 or possibly 2 fingers. I'm going to curl down and sink down towards the coronoid process of the ulna. With my other hand, I'm going to add a little bit of resistance to her radius as she turns over into pronation. So I'll give her a little bit of resistance. Good. And as she does that, that second deeper attachment is going to start to stick up a little bit, and you can relax. Well, let's do that one more time. Good. So the coronoid process is quite deep. on that proximal part of the ulna. So again, you might not feel its projection itself, but we're trying to get the deeper belly. Just take due caution because the median nerve does go between those two heads. So as you're palpating this area, just make sure you're not compressing the median nerve as you go. And again, get her to do a little bit of pronation against my thumb here for resistance. And I can easily outline the Pronator Teres as we follow it lateral, and it's heading towards the radius. It's often inserting halfway down the radius, so mid-lateral surface of the radius, and some will refer to that as the pronator tubercle. So again, if you pull against me gently, excellent, and relax. As you sink in, you should be able to kind of cross fiber those oblique components of Pronator Teres. As Pronator Teres is starting on both humerus and ulna and inserting on radius, its primary function is obviously in its name, pronation of the radial ulnar joints, but because of that humeral attachment, it will also do flexion at the elbow. The Pronator Teres is innervated by the nerve that passes between its two heads, and therefore that is the median nerve. This video is for palpation of the muscle known as supinator. Supinator is a deep muscle of the extensor surface area of the forearm. It has two large attachments that insert into one large insertion. Our first attachment is going to be on the lateral epicondyle of the humerus here, and this portion of it's going to wrap in this direction towards the radius. And the second attachment is called the supinator crest of the ulna. Now, this one's a little bit tricky to get at, but I'm going to name off a couple of bony landmarks to help us landmark ourselves and where we will be looking. First thing is finding the ulna and working our way distal along that shaft. The second portion is where is the head of the radius. So I've landmarked her head of the radius, just distal from the lateral epicondyle of the humerus here. The supinator crest is distal to the radial notch, which is currently where this head is sitting in on the ulna. So if you've palpated the head of the radius, you need to be below that on the ulna, basically where my thumb is right now. It is fairly long in relationship to this muscle kind of attachment, so I'm going to sink in between the ulna and the radius, right in this area here. And then I'm going to ask my partner to supinate and turn her hand over. Good. Go back. Let's do that a couple times. So you'll feel a lot of pressure build up as we're over top of supinator, but this muscle is underneath all of the extensor group, so it will be tricky to feel. So we have fibers running in this direction as well as fibers running in this direction as they wrap around the whole proximal radius. So the insertion of supinator is kind of three parts in that it says it's the posterior, the lateral, and the anterior surface of the proximal radius, kind of just distal to the head. So again, if I can feel where that head is, I'm going to sink in a little bit through the extensor groove, ask her to supinate. Good. And back. We'll go a little bit further onto kind of that lateral, get her to do that again. Good. And this last part here, I'm going to try to pull her wad of three over, the most anterior muscle being brachioradialis. I'm going to position her arm slightly differently. So I'm going to take a couple fingers, hook in past brachioradialis and drop down onto that proximal radius. And again, I'm going to ask her to supinate against a little bit of resistance. Good. And relax. This area can often be a little bit tender, so just take care when you're palpating this muscle. And that will be origin to insertion from supinator. Its actions are obviously supination of the radial ulnar joints of the forearm, but secondarily, it does some flexion of the elbow. And just like all of our muscles on the extensor surface, it is innervated by the radial nerve. This video is for the palpation of Flexor Carpi Radialis. We're going to start by identifying the medial epicondyle of the humerus here. This muscle originates in this location. It's going to be traveling with the other superficial forearm muscles down towards the hand. And I'm actually going to be identifying the insertion next, and then we'll fill in the muscle belly in the middle. Its insertion is going to be into the base of the second and third metacarpal of the hand on the palmar aspect. So a tip to help get this is to start by palpating the dorsal surface and feeling for the widening of the base. So right here underneath my thumb is the base of the second, and next to that the base of the third metacarpal. Now, taking that placement, it's going to be really, really tricky to sink through the thenar muscles, but I'm grabbing with my thumbs on the palmar aspect where my index fingers are feeling the same location on the dorsal aspect. So right in this location right here is our insertion. There's one tendon crossing the wrist, but it splits into two as it finally makes its insertion point. I'm going to ask my partner to do a little bit of wrist flexion, just hold that, and right in here I can start to feel it's a very obvious tendon and go back and forth. Now I'm going to give her resistance across her metacarpals as she holds that position, and we will cross fiber this tendon all the way up the forearm. It's going to be tendinous for the majority, or even this distal half, until it starts to turn more into a muscle belly. So you should be able to quite easily cross fiber all the way up. And on my partner, it's about here. So our tendon is about that long. Then it starts turning into a muscle belly, and I'm going to have you repeat that action a few times. We'll go like so. Good. And I will follow the muscle belly all the way up towards our origin, which we already found, which was the medial epicondyle of the humerus via that common flexor tendon right here. So our actions that we're looking at with this muscle is that it does flexion of the wrist as well as radial deviation and a very weak elbow flexor. This muscle is also innervated by the median nerve, which are most of our forearm muscles. We're going to be palpating Flexor Carpi Ulnaris. Flexor Carpi Ulnaris has two origins. So the first one I'm going to identify is the humeral attachment of the common flexor tendon and the medial epicondyle of the humerus, which is right in this area. I'm going to show my partner the action I'd like her to do, which is a combination of flexion and ulnar deviation of the wrist. So she's going to repeat that a few times, and I can easily feel my fingers getting picked up and kind of lifted from that muscle belly in this region right here. So this would be one of its two attachments. Now the other attachment is going to be on the ulna itself. So we're going to be positioning her arm kind of just by adding more flexion into it so you can have a visual of the olecranon. So the olecranon right here is a part of the secondary origin, but we're going to slide onto kind of more this posterior medial surface. Just take caution because there is a nerve very close by as the ulnar nerve goes between these two heads of Flexor Carpi Ulnaris. You're going to gently push your fingertips onto that ulna, that proximal surface, and I'm going to ask my partner to again go by and do that same action, so flexion and ulnar deviation. Good. And again, you can easily feel your fingers getting lifted from that ulnar shaft. So we have the proximal ulna and olecranon as our secondary origin, along with that again medial epicondyle of the humerus. I'm going to turn her hand a little bit on this, and I'm going to use a pincher grasp now, and she's going to repeat that action a few times, and I'm going to follow down her forearm as she does that, making our way towards the wrist. And around this region, it's starting to turn more tendinous, so I'm going to bring her forearm down, and we're going to again just kind of repeat that action a few times as I follow our tendon towards the carpal bone area and its insertion. Now this time I'm just going to give you some resistance and just pull against me. Good. So as we cross the wrist right in here, the first of its three insertions is on what we call pisiform. So this carpal bone on that proximal row. From pisiform, the next attachment is going to be a little bit distal, so we roll off of pisiform and head in towards the palm of the hand slightly, and this is the hook of hamate, right in here in the distal row carpals. And then again, the third and final attachment is right here on the anterior base of the fifth metacarpal. So again, you can use the lateral side or the outer side, I should say, of this carpal bone to feel where its base is. So we have 3 insertions: pisiform, hook of hamate, anterior base of the fifth metacarpal. The nerve that went underneath flexor carpi ulnaris was the ulnar nerve, and is also the nerve that innervates this muscle. We're going to be palpating the Flexor Digitorum Profundus in this video. The muscle itself is going to be originating solely on the ulna for boning wise and a little bit of the interosseous membrane. It does not cross the elbow joint like its counterpart Superficialis. So for this, what we're going to be using is identifying the ulna using the easiest part to find, which is kind of that posterior aspect. So right in here, I can feel the olecranon and then that ulnar shaft. Now the muscle is originating on the anterior surface, so I'm kind of on that posterior medial. What I'm actually going to try to do is curl my fingers on towards the front part of it. Now you should actually be able to feel quite a large muscular belly right off to the side as we're on the medial part of profundus. You're having to push through flexor carpi ulnaris in this, so we're actually going to differentiate them just so you can see the difference. She's going to start by ulnarly deviating her wrist a couple times, like so for me. Okay, I'm seeing kind of minimal motion, a little bit under my fingertips, but not a lot. Now what I'd like you to do is with your hand, make a tight fist and squeeze that a few times and relax. And do that again, and you can easily see that profundus is a much larger muscle belly underneath flexor carpi ulnaris. So superficialis is going to be sitting on top in this area here, and I'm underneath it trying to get more on top of the ulna. So I'm going to slowly work my way down that anterior part of the ulna. Can you repeat that again? Good. And let's go a little bit further and repeat it again. Excellent. And we'll go a little bit further. And I'm slowly working my way distal down the ulna. Now the coronoid process, which is also part of its origins, can be really tricky to find, especially differentiating between superficialis and profundus. I'm going to work my way back up. Instead of just being along that medial part, I'm going to try to sink through. Now to isolate it, we had superficialis doing this action, but I would like profundus to work on trying to flex that distal phalanx for us. So I'm going to sink in and get her to relax, and then try to get her to repeat that a few times. So more on the anterior surface of it, trying to get some profundus action more than superficialis, trying to stick up. Good. As we work our way towards the wrist, just like superficialis, it's going to turn into tendons. In this case, it's really going to be challenging for us to differentiate them, so we're not going to. All 8 tendons, 4 from superficialis and 4 from profundus, will be going through our carpal tunnel. Again, quick identification of the flexor retinaculum with the scaphoid tubercle, trapezium tubercle, pisiform, and hook of hamate. So in between there will be the 4 tendons for profundus as they work their way into the hand. Now in a previous video for superficialis, we would have been trying to identify its tendons, but in this case, we're going to be adding some resistance just to the distal phalanx for profundus. So I'm going to start with her second digit here and get her to pull against that as I follow the tendon out towards the finger. There's a really good chance you will not be able to identify exactly superficialis versus profundus. Superficialis is more superficial in its name, profundus meaning deep. But once superficialis inserts in that Y shape as it splits, profundus tendon continues past it, inserting into the distal phalanx. So it's going to be inserting into the distal phalanx of digits 2 through 5. So we're going to repeat this process for each finger. I'm following out along the tendon, past that middle phalanx and inserting into the distal phalanx. And again, we'll repeat it for the 4th finger here. And finally for the 5th finger. Now, for Profundus's actions, again, it's going to be creating flexion at all of our finger joints. So it's going to curl the whole hand up into a fist, plus adding a little bit of wrist flexion at this joint here. And uniquely, Profundus has 2 innervations. The more medial half of it is from the ulnar nerve, and the more lateral half of it is from the median nerve. We're going to be palpating Flexor Digitorum Superficialis. Now, Flexor Digitorum Superficialis is in our 2nd layer, so we had 4 muscles of the 1st layer, and now we're going to be going through them to get to the 2nd layer. Flexor Digitorum Superficialis has multiple origins, so we're going to go through all 3 of those to start here. The first thing I'm going to be doing is finding her medial epicondyle, and therefore the common flexor tendon. Now I'm going to show you the action with my other hand, and what you're going to be doing is basically closing your hand but leaving the distal fingers straight. So I almost call it a one-handed kind of clapping motion, like so. Good. So you're going to be repeating that several times throughout this. So right here off that medial epicondyle. What we really want to avoid to help identify this muscle is any wrist action, because all the other muscles off the medial epicondyle typically have some motion to do with the wrist or the supination, pronation. We're going to be just sticking with just finger action for this. Okay, excellent. So we'll repeat that. The second origin is going to be on the ulna, and that's the coronoid process. You can stop the action for just a moment. I'm going to passively flex her elbow up. I'm going to take my fingertips and sink down towards that ulna. So again, this is in a similar location for Pronator Teres, but instead of any pronation action, again, we're going to get her to repeat that finger movement. So again, I'm getting a muscle contraction underneath my finger here, which therefore needs to be superficialis. That's the second origin, and the third origin is going to be on the proximal anterior surface of the radius. So one of the things that we're going to be looking for is it has to be distal to the biceps tendon insertion, because that's on that bicipital tuberosity. So I can cross fiber her biceps tendon right in here, which is taking us to about there. And the radius is deep to my fingers. So I'm going to go just past that. We're on the anterior surface of that proximal radius, and she's going to repeat that action with her hand. And I can easily see my fingers going up and down. There's actually a gap which has the median nerve going underneath it, so I'll mention at this time the median nerve is what innervates Flexor Digitorum Superficialis. For our muscle belly, I'm going to squeeze the whole second layer as best I can. So I'm going to put some fingers on this side here, close to the ulna, and my thumb on the opposite side, near that radius attachment, and I can get her to repeat that motion. Now I'm getting pushed out on both sides, which is a good sign that I'm on superficialis. And I'm going to travel down the forearm, repeating this large squeezing motion. Flexor Digitorum Superficialis is going to be muscle belly for over half of kind of that forearm before it starts to turn into tendons. And those tendons are going to travel down the rest of the forearm and then enter into the carpal tunnel. So if you've watched previous videos, you might have seen me outline the flexor retinaculum between the scaphoid, trapezium, pisiform, and hook of hamate. But the 4 tendons of superficialis will go underneath that retinaculum before entering into the hand. At this point, it's going to send out 1 tendon for each of the 4 fingers here. So what I'm going to ask my partner to do is hold her finger like so as I resist on that middle phalanx. Its insertion is going to be on that middle phalanx, which is why I'm adding my resistance here. I'm going to follow our tendon out through the palm of the hand, crossing the metacarpal phalangeal joint, and then it's going to insert on both sides of the middle phalanx. So our tendon crosses the metacarpal phalangeal, that proximal interphalangeal, before splitting into two insertion sites on both the medial and lateral side of this middle phalanx. We're going to repeat this process for the other fingers as well. So for finger number 3, again, following our tendon out before it inserts in 2 locations. Repeat it for our 4th finger here. And finally, for the pinky. Like so. The actions for Flexor Digitorum Superficialis, so we'll try to show you, is it's flexing at the metacarpal phalangeal and that proximal interphalangeal, but not the distal. So as we close the fingers up, we leave those distal ones straight. And it's also going to flex at the wrist and have some weak flexion of the elbow as well. And as I mentioned earlier, it's innervated by the median nerve. We're going to be palpating Flexor Palmaris Longus in this video. So we're going to talk about its insertion and work its way back towards the origin. Now, in its name, longus meaning longer, there is a brevis in the hand, but for now we're going to discuss just this muscle. Its insertion is going to be into the base of the distal phalanx of the thumb. That's going to be acting on this interphalangeal joint as well as on the metacarpal phalangeal joint, the carpal metacarpal joint, and the wrist. Now, interesting, its pathway is one of the 9 tendons going through the carpal tunnel. So it accompanies Flexor Digitorum Superficialis and Profundus as they go through this region here. So as I add a little bit of resistance to that distal phalanx in flexion, we're going to follow our tendon heading medial to both trapezium and scaphoids tubercles as it makes its way with those other 2 muscles through this carpal tunnel. As it crosses, it's then going to head over towards the anterior surface of the radius. Now, a lot of text reference its origin is on this distal anterior surface of the radius. We've got to make sure that we're above Pronator Quadratus, which you can look in another video, which is taking up the most distal part. So you're going a little bit higher than Quadratus's origin. Now I'm going to ask my partner to repeat flexion of the thumb, and I can easily feel, and you can probably even see my fingers going up and down in this region. So there's actually 2 different variations of this muscle in different reference texts, and one of which ends in this area. So the origin is here on that anterior kind of middle distal surface of the radius and its interosseous membrane. But there is a longer variation of this muscle, which actually has a slip that follows very similar to Flexor Digitorum Superficialis. So we're going to take a look and see if our partner has that one today. She's going to keep repeating that action. And what you would do is follow a similar pathway that Superficialis did up towards the medial epicondyle of the humerus. Now, I'm not feeling a whole lot in this case, but if we did, you should be feeling your fingers going up and down. The longer version of this muscle has 2 attachments up here, similar again to Superficialis, in one being on the coronoid process of the ulna, and the other attachment crossing the elbow joint and inserting onto the medial epicondyle of the humerus right here. So if your muscle is the shorter version, you'll be doing flexion of the carpal metacarpal phalangeal and interphalangeal joint, as well as a little bit of weak wrist flexion in this. If you have the long version, it might have some relationship to do with some pronation, as well as weak elbow flexion. For the purpose of this though, we're mainly going to be sticking with the shorter version and motion of the thumb. This muscle is also innervated by the median nerve. going to be palpating Palmaris Longus today here. So the first thing I'm going to do is identify its origin, and we're going to be looking at the medial epicondyle of the humerus, and again via the common flexor tendon. So I'm going to show you kind of the action with my other hand. What I want you to do is bring all of your fingers into a point and then flex your wrist up like so. Good. And I'm going to have you repeat that a couple times. Great. I'm going to follow down over top of the forearm belly. Let's do that again. Good. And this time I'm going to have you bring your fingers to a point and just hold it there. Now I'm going to be providing some resistance against her wrist flexion. And what you should actually be able to see right away is that this tendon is starting to stick up. It is a very superficial tendon. There is a population of people that do not have Palmaris longuses. So in some people you may not see this tendon sticking up, but it is very close to the surface. So if I get her to relax her wrist for me, and again, just start to do that wrist flexion right away, hers sticks up nicely, very easy to see. If you don't see it, just try to palpate that superficial tissue. So with this tendon, again, I'm going to gently cross fiber heading back down towards our origin, which was on the medial epicondyle, like so. You can have your person pulse it if you want to, using repeated wrist flexion, but if not, it should be fairly easy to follow in a straight line heading back towards that origin here on the medial epicondyle. Now for its insertion, this one is a little bit more interesting, so we're going to outline what is called the flexor retinaculum. In this location right in here, I'm palpating the scaphoid tubercle. Just distal to that and towards the thumb, we have the trapezium tubercle. So I'll put 2 fingers on that. On the ulnar side of the hand, we have the pisiform. And just distal to that is the hook of hamate. So these are the 4 attachment sites for the flexor retinaculum. So I'm going to pinch that currently right here. So this is the first insertion of Palmaris longus. So this tendon attaches into this ligamentous structure right in here and then splays out into the palmar aponeurosis of the hand. I'm going to ask that you just spread your fingers and hold that position as I'm going to kind of pull down against them. Good. I'm going to try to use one hand on your fingers and try to do that again. So the palmar aponeurosis covers the entire palm of the hand and kind of creates this outlining layer as it tightens up all the fascia in the space. So that is the secondary attachment and insertion for Palmaris longus. Its action is not really to have any function on the fingers, so it will not be flexing the fingers, but it pulls all this fascia together. So we often ask the person to bring all their fingers to a point, tightening up the palm of the hand, also tightening up that flexor retinaculum, but the action at a joint is to create wrist flexion, which is why we added some resistance when all those fingers are together. Go ahead and push up against me, and you can easily see that Palmaris longus tendon. Palmaris longus is also innervated by the median nerve. We're going to be palpating Pronator Quadratus, which is the most distal, deep muscle of the forearm. Now, if you're thinking about origin and insertion, which both origin and insertion are the distal anterior surfaces of their respective bones, the easy way to remember this is that the insertion is often the mover. So in this case, the radius is what moves, therefore the ulna is more stable, and therefore the origin. Now, this one's a little bit tricky because it's underneath all of the distal tendons in this area, plus arteries and nerves, so do take care as you're trying to feel its origin. Landmarking the distal end of the ulna, aka its head, I'm going to go just above that onto more of its shaft. I'm going to passively flex her wrist up a little bit, take my fingertips and push some of the tendons over out of the way. So that obvious tendon in this area is Flexor Carpi Ulnaris. Once I've tried to get onto that distal anterior surface, I'm going to ask my partner just to try to pronate their hand against some resistance. Good, and relax. And we'll repeat that a couple times. And you may feel a little bit of the muscle fibers starting to lift up. Now the muscle fibers in this case are running like so, crossing from ulna over to radius. So again, Finding in the middle and the belly is going to be extremely challenging, but we're going to, for palpation's sake, she's going to try to turn over. Good, and relax. And then again, try to turn over. Great. And the insertion is going to be on the distal anterior surface of the radius. So again, this being the styloid process of the radius, I'm going to go a little bit above that. I'm going to again passively flex her wrist and push flexor carpi radialis tendon out of the way and trying to get onto that distal anterior surface of the radius. As we do that, she's going to try to turn over again into pronation. Excellent. And I feel a little bit more on this side. It's a little bit more space. So you can actually cross fiber a little bit of this muscle. Again, Pronator Quadratus. Its action is going to be performing pronation of the radial ulnar joints, and it's going to work in conjunction with Pronator Quadratus and Pronator Teres. So she's going to be basically turning her palm over like so. Again, give her a little resistance. Excellent. And this muscle is also innervated, like many of the muscles in this area, by the median nerve. We're going to be doing a video for the palpation of Abductor Digiti Minimi, and I'm going to use the word manus. Technically, there's an Abductor Digiti Minimi of the foot, which is referred to as pedis. So for this one, Abductor Digiti Minimi manus. Abductor Digiti Minimi is originating off of two items. The first bony item is this small bone on the palm of the wrist. It's in your proximal carpal row, and it is called pisiform. So I'm doing a full circle around pisiform currently right now. So this will be its bony origin. The second origin is actually on a tendon, and the tendon is just proximal to pisiform, and this is for the muscle known as Flexor carpi ulnaris. I'm going to have my partner do just a little bit of ulnar deviation while I resist her just a little bit. Good. And right there is that tendon of Flexor carpi ulnaris. As we activate this muscle, we'll actually be able to see this tendon tightening up as it goes through its action. So what I'm going to have her do is bring her pinky far away as she can, and then bring it back, and then do that on her own. You can see right in this area. Go ahead and bring it all the way out. Good. Tightening up right in that tendon space. So the origin of the tendon of Flexor carpi ulnaris, as well as the bone pisiform. The muscle travels on the outer side of the hand, so the most medial part of the hand. So we can actually do a nice pincher grasp on one side and follow it all the way down. Now, if she actually relaxes her hand as much as she can, good, you'll actually see, and oftentimes as you're pulling on it, the pinky moving itself. So the belly of our muscle is right in here. I'm going to have you go through that action a couple times for me. Good. Follow that, passing the metacarpal phalangeal joint right here and inserting right there on the medial side, base of the proximal phalanx of this fifth digit here. Okay. Its action, very, very minimal at the carpal metacarpal joint and almost exclusively of abduction of the fifth digit at this metacarpal phalangeal joint. And all of our hypothenar muscles here are innervated by the ulnar nerve. We're going to be palpating abductor pollicis brevis. So abductor pollicis brevis, pollicis meaning thumb and brevis meaning short. It's going to be one of our first muscles on this thenar side of the body here. It's originating off of two carpal bones. First one being right here, being scaphoid. And it has a tubercle on this anterior portion of it. And a little bit distal and lateral towards the thumb. Right here is going to be our second carpal bone called trapezium, and it also has a tubercle. Both of these tubercles are on kind of the palmar side, and they're also attachments for the flexor retinaculum. So this muscle sometimes has flexor retinaculum as one of its origins. This muscle is responsible for doing abduction of the thumb, and that's happening here at the carpal metacarpal joint. So I'm going to have my individual trying to lift their thumb up away from the index finger like so, while I provide a little bit of resistance on this proximal phalanx. And right in here, we can see the muscle is actually quite tight. So originating here and here, and muscle belly, and it's crossing the metacarpal phalangeal joint and inserting right here on the base of this proximal phalanx of our first digit, or the thumb. So this is doing, again, abduction. It's really hard for abduction to occur at the metacarpal phalangeal joint. So most of that action is happening here between the trapezium and the metacarpal, the carpal metacarpal joint. And this muscle is innervated by the median nerve. We're going to be palpating adductor pollicis. Adductor pollicis is quite a broad, wide muscle in its origin and one smaller, narrow insertion, and often takes on a triangular shape. There is two heads for adductor pollicis, so we're going to be starting with going through the origins of the transverse head, and then we will go on to the oblique head second. The transverse head is originating off the anterior surface or shaft of our third metacarpal. So the first thing I'm going to do is identify her metacarpal phalangeal joint, this being the head of that third metacarpal. So I'm going to take two fingers and kind of gently go back and forth all along the anterior shaft of the third. So this is the origin for the transverse head. To make sure I can start to feel that, I'm going to ask her to take her thumb and bring it over and try to squeeze almost her second and third metacarpal. So we're going to bring her back. I'm going to place a couple fingers along that origin, and she's going to squeeze my finger right here. Good. And that is activating that component of this muscle. As I follow back on this shaft, what you don't see is that I'm also feeling the posterior aspect. And when I can have a better sense of where the base of number 3 is, which is right about here, I have my thumb in a similar location on the front. The oblique head for adductor pollicis is originating off the base of the third metacarpal, just lateral to that, the base of the second metacarpal, and just proximal to the third metacarpal on the carpal bone called capitate. So it has 3 bony origins: capitate, the base of 2, and the base of 3 in those metacarpals. Both of these two heads are running together as they insert into one common location. I'm going to fire off her oblique head. Just like the previous video you may have watched on opponent's pollicis, adductor pollicis is quite deep on this oblique head, and it will be very challenging for us to feel directly. What I'm going to ask her to do is squeeze her thumb in between 2 fingers towards her index. Great. And I'm going to travel along here, heading towards that proximal phalanx. Good. So the adductor pollicis is going to be inserting on this side of that proximal phalanx. So we'll call that the medial side, and it's often called the base of that proximal phalanx. So medial side, base of the proximal phalanx of the thumb for our insertion point. So again, origin in this area, origin, 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 as the two heads come together and inserting here, producing adduction of the thumb at the carpal metacarpal joint primarily, and a tiny bit of action at the metacarpal phalangeal joint. The adductor pollicis is innervated by the ulnar nerve. We're going to be palpating Flexor Digiti Minimi Manus. Flexor Digiti Minimi Manus is on the hypothenar side of the hand, and it's going to be responsible for creating flexion of our 5th digit here. We're going to be starting off at its origin. I'm going to be locating the pisiform bone first. This is not a part of its origin, but I will use it to help me find the hamate. So I'm going to roll off the pisiform, landing on the hamate, and head slightly lateral, technically more into the palm of the hand. And I'm going to ask her to flex that 5th digit up. Excellent. So underneath my fingertip, I can feel a muscle contraction of our flexor digiti minimi, Its secondary attachment is here along the flexor retinaculum. So we have a soft tissue attachment as well as bony attachment. I'm going to change my hand position so I can give her a little bit of resistance on that proximal phalanx. And as I do so, this muscle tightens up quite a bit. I'm going to turn to a pincher grasp and follow it from its origin, heading towards the insertion, which is over here on the medial side of the base of the proximal phalanx of the fifth digit. I'm going to turn our hand just to the side, again locating the metacarpal phalangeal joint here, so just to the outside of that on the medial side, base of that proximal phalanx. So origin to insertion, and it is going to be flexing the fifth digit at the metacarpal phalangeal joint, as well as it is innervated by the ulnar nerve. We're going to be palpating Flexor Pollicis Brevis. Flexor Pollicis Brevis is one of our thenar muscles here, with abductor being more lateral on the outside. Flexor is partially covered and more into the palm of the hand, so abductor is sitting on top of flexor a little bit. Abductor was originating on both scaphoid and trapezium, where flexor is just off the trapezium. So I'm going to first start by palpating the scaphoid tubercle, but then I'm going to roll into the palm and towards the thumb, and right in here is the tubercle of trapezium. So this is one of its origins, and the second part being the flexor retinaculum, which is crossing the wrist in this location, which also attaches to that same tubercle. So I'm just going to show my body the two different motions so we can differentiate which one is which. So this thumb up motion is abduction versus bringing the thumb in towards the palm of the hand like so. It's going to be flexion. So just to make sure that we don't feel abductor, I'm going to be resisting on the insertion. So I'm going to have her curl into my finger here. Excellent. And right in this area, it's going to be a little harder to pick up, but running this direction towards our thumb is Flexor Pollicis Brevis, and it is also going to be inserting in a similar location to abductor right here on the base of the proximal phalanx of this first digit, the thumb. So again, our pathway running from trapezium to the proximal phalanx. Now uniquely, Flexor Pollicis Brevis often is described as having two heads, a superficial and a deeper head. And because of that, it has two nerve innervations, one of which is the median nerve and one of which is the ulnar nerve. We're going to be palpating the lumbricals manis, so lumbricals of the hand. There are four individual lumbricals for each of the four fingers. It's a little bit tricky as we're going to go through, so there's quite a bit of information that we'll try to get through in this video here, but we're going to start with our origins. Now the origins of lumbricals are on a tendon, and that tendon is Flexor Digitorum Profundus. So as the profundus comes through the carpal tunnel, has one tendon going for each of the four fingers, and in the palm area, over top of kind of these metacarpals, each lumbrical is originating on that tendon for profundus. So what I'm going to do is ask her to curl just the distal phalanx of the second digit here, and I'm going to try to cross fiber and feel where that tendon is. So I've landmarked the tendon. It's probably superficialis, but again, that's directly over top of profundus, so giving us the same area. And now I'm going to be trying to identify the belly of this first lumbrical. Now the lumbrical is originating on the lateral side of that tendon, and it heads into crossing this first joint into the base of the proximal phalanx, and then that dorsal digital expansion. Because it is attaching to the proximal phalanx, the major action it does is to flex at the metacarpal phalangeal joint. But because of its attachment to the dorsal digital expansion, what it actually does is extend the proximal and distal phalanx. So it's going to create this type of a motion. Flexion of the metacarpal phalangeal joint as it extends both proximal and distal interphalangeal joint. So now that I've shown her that, I'm going to ask that she pushes up on my finger while keeping the digit straight. Great. So again, off of the profundus tendon, going lateral and sinking in. Can you repeat that action a few times for me? Good. And I'll be palpating the first lumbrical here. Okay. I'm going to repeat that exact same procedure on our second finger. So I'm going to give you a curl, identifying our tendon through the palm of the hand. Great. And then I will switch over to resisting on that proximal phalanx. Good. So in between the metacarpal 2 and 3, coming off of that lateral side of our profundus tendon, is our second lumbrical as it inserts into the base of this proximal phalanx on the lateral side, as well as the dorsal digital expansion. And then for our third and fourth lumbricals, they're a little bit different in the fact that there's actually two bellies. So one of the bellies is going to be originating off the profundus tendon of our fourth finger, and the other one is off of the tendon for our third. So I'm going to pull on both of them. So one origin here and the other origin here. As this muscle bellies come together, they're going to insert onto the base of the proximal phalanx on the lateral side for our fourth finger and its dorsal digital expansion. So again, I'm going to have you hold your finger up like so as we're palpating down over top of our third lumbrical belly. Good. And then the same thing is going to be repeated for our last lumbrical. It's originating off the profundus tendon, so if you can curl here and curl here, originating on the third and fourth profundus tendons. Again, two bellies, and they insert onto the base of the proximal phalanx for our fifth. So I'll add some resistance on that proximal part. Great. So following it down, inserting again into that lateral side and its dorsal digital expansion. So as all four of them work together, they provide an action that looks like so. Okay, so again, creating flexion at the metacarpal phalangeal joint and extending the interphalangeal joints for digits 2 through 5. Lastly, there's two nerves. The more lateral muscles, these first two, are innervated by the median nerve, and our two to the more ulnar side is by the ulnar nerve. We're going to be palpating opponens digiti minimi. Now, opponens digiti minimi is going to have the same origin as flexor digiti minimi. So I'm going to start again by finding our piezoform first, rolling off of piezoform, and then heading slightly into the palm of the hand. I'm looking for the hook of hamate here. Again, the same origin as flexor digiti minimi. So it has the hook of hamate as well as the flexor retinaculum crossing the palm in this area, location. Now, similar to opponens pollicis, this muscle does not cross the metacarpal phalangeal joint, and it's actually going to be going from the hook of hamate, crossing over and attaching all along the more medial part of this fifth metacarpal. Again, so one origin with quite a broad, long insertion in here. So it's going to cross like so. It's underneath our hypothenar muscles, like flexor and abductor, so it's going to be really challenging for us to feel. Plus, the act of opposition for the fifth is a minor action itself. So it's going to roll this fifth digit into the palm of the hand, grabbing that metacarpal and kind of rolling it forward. One of the ways to cue our person is to try to bring their thumb and pinky finger together. We're not looking for the flexion that is occurring at this metacarpal phalangeal joint, but more so the metacarpal going from this flat position to rolling forward like that. Okay, can you do that one more time for me? Excellent. So I'm going to be on hook of hamate. You're going to do that one more time, and I'm going to palpate heading medial and all along this metacarpal here, like so. And that will be our muscles palpation. This muscle is, just like all the other hypothenar muscles, innervated by the ulnar nerve. We're going to be palpating opponens pollicis. Opponens pollicis is the deepest of the three thenar muscles in this area. It's going to be fairly hard for us to distinguish versus abductor and flexor. Its origin is in the same location as flexor. So previously we had found flexor, but we start by locating the scaphoid, moving distally into the palm and slightly towards the thumb. And underneath my thumb right now is the trapezium, and specifically its tubercle. Its secondary attachment is the soft tissue known as the flexor retinaculum, crossing the wrist in this location right here. Its origin, being similar to flexor, has a similar pathway, except it is not crossing the metacarpophalangeal joint, and its muscle is instead wrapping over to the lateral side of the metacarpal. It's fairly deep, as I mentioned earlier, so it's underneath these two layers, so it'll be hard for us to sink directly to it, but the muscle goes from approximately this location, crossing over and attaching all along the shaft of this first metacarpal. The action of it is to roll this metacarpal in towards the palm, so the active opposition. So what I'm going to do is I'm going to show her the action. It rolls the thumb into the palm of the hand like so, whereas flexor obviously is curling the thumb in here. So what we're going to try to ask her to do is to bring her thumb and her pinky together without adding any flexion at these two joints. So if you can do that for me on your own. Good. So that is the active opposition of both first and fifth digit. Now I'm going to get you to try to replicate that one more motion with me, just pushing against my thumb, trying to do the same thing. Great. And I'm going to sink in and go through the flexor and try to find the opponent's muscle underneath. So we're trying to do least amount of flexion as possible and trying just to get that opposition movement. Okay, so there's our palpation from origin to insertion. Now the opponens pollicis is innervated by the median nerve. We're going to be palpating both palmar and dorsal interossei, and we're going to be starting with the palmar interossei, so I have her palm up. We're going to be going through the actions of palmar interossei just to make sure that our body knows what actions we're going to be doing, and so we can identify the muscle bellies correctly. Palmar interossei is going to be acting on digit number 2, number 4, and number 5, and they adduct. So basically the second digit is going to be brought over towards our third. Our fourth finger is brought over towards our third, and our fifth finger is brought over towards the fourth digit. Palmar interossei is in the deepest layer of the palm, and its origin is actually on the metacarpal that it basically inserts to that same finger. So a good way to remember it is, since we're looking for a muscle that's going to be acting on digit number 2, its origin is on metacarpal number 2. Because it is bringing it over towards the third, it's going to be on the medial side of that same metacarpal. It's going to be a little bit tricky for us to try to palpate down at depth. What we're going to do is, again, identify the location approximately where the shaft is. I'm going to be sinking in between metacarpal number 2 and number 3, and I'm going to ask her to try to bring her pinky over towards her third, like so. I might even provide a little bit of resistance in there. Excellent. And now I'm starting to feel a little bit of muscle tensing up underneath my fingertips. Just going to relax and do that again for me. Great. As I follow it from that shaft of that second metacarpal, it's inserting into the base of the proximal phalanx of that second digit, as well as its dorsal digital expansion. So besides adduction, the secondary actions for this muscle are to include flexion of the metacarpophalangeal joint while extending both proximal and distal interphalangeal joints. Okay, so there is muscle number 1. Muscle number 2 is going to be originating on the shaft of our fourth metacarpal. Because it's bringing this digit closer, it's going to be on the lateral side. So I'm going to be palpating in between metacarpal number 3 and 4, but hooking my finger towards that fourth one. I'm going to provide her a little bit of resistance here. Excellent. So palpating the origin on the metacarpal's shaft as it crosses and inserts on the lateral side, base of the proximal phalanx of this fourth digit and its dorsal digital expansion. And for our last muscle, the third palmar interosseous belly, we're going to palpate on the shaft of our fifth metacarpal, also on the lateral side here, and I'm going to provide her some resistance there. Good. So we'll follow that last muscle belly down, inserting again on the lateral side, base of the proximal phalanx, and the dorsal digital expansion. All three of these bellies are going to be innervated by the ulnar nerve. At this point, we're going to be turning the hand over and going on for the palpation of dorsal interosseous. So palmar was doing adduction as its primary action. Now dorsal interosseous does abduction. So again, we're going to go through the actions with our partner just to make sure that they understand what the fingers are about to do. So for abduction, we already have a muscle in abductor pollicis, and we also have an abductor digiti minimi. So we're really going to be performing abduction of the other three digits. So one of our first bellies is going to be abducting the second finger over. The second dorsal interosseous will abduct the middle finger towards the second, but the third one will actually abduct the middle finger the opposite direction. So we have two dorsal interosseous attached to our middle finger, which means it abducts both directions since there is no adductor. The last and fourth of the bellies is going to be doing abduction of the ring finger here, moving it away from the third. Okay, so now that we've kind of gone through the actions of dorsal interosseous, there are 4 of them, 1 for the second, 2 for the third, and 1 for the fourth finger. So now we'll go through the origin, insertion, and their palpations. The first one is going to be originating on 2 locations, just like all of the other dorsal interosseous muscles, but its first origin is here along the shaft of the first metacarpal. Its second origin is here on the shaft of the second metacarpal. So a lot of text references as adjacent metacarpals, or it could be adjacent metacarpals number 1 and 2. So while palpating in that post-thenar web space, you can ask the person to abduct their second digit out, and it's quite easy to feel a lot of tension inside this muscle. As the 2 muscle bellies come together and blend, they cross the metacarpal phalangeal joint, inserting here on the lateral side, base of the proximal phalanx of the second digit, as well as its dorsal digital expansion. For the second belly, again, adjacent metacarpals number 2 and 3 this time. So I'm going to sink my finger onto that second, as well as sink my finger onto the third. I'm going to ask my partner to push up against this finger here. Great. So she is abducting her third finger towards her second as I'm sinking in between, finding the 2 origins. And again, it's going to cross, inserting a similar location on the lateral side, base of the proximal phalanx of the third finger and its dorsal digital expansion. For the third belly, we're going to repeat the process, palpating the shaft of the third, as well as the shaft of the fourth metacarpal. And this time we're going to have her moving her third finger in the opposite direction. So she's going to push against here. Excellent. As we palpate in between those 2 metacarpals. We're now on the medial side, base of the proximal phalanx of the third finger and the dorsal digital expansion. And repeating ourselves one more time, originating off the shaft of the fourth and the shaft of the fifth metacarpal, in between there, and asking you to abduct this ring finger. We will palpate down, inserting again the medial side, base of the proximal phalanx, and the dorsal digital expansion. Last couple things to mention, just like palmar interosseous, the primary is the abduction for dorsal, but it also performs flexion of the metacarpal phalangeal joint while extending the 2 interphalangeal joints due to that dorsal digital expansion. So for dorsal interosseous, that was abduction and flexion of the metacarpal phalangeal while extending the interphalangeal. Both palmar and dorsal interossei are innervated by the ulnar nerve.